Welcome back. This is part 3 of 101 Addiction Counseling Terms, a 4-part video series designed for exam prep, continuing education, or simply learning about addiction counseling. I'm Letitia Wiggins, a licensed professional counselor and licensed substance abuse treatment practitioner. In this video, we're diving into terms 51 to 75, and just like in the first 2 parts, I'll break each term down using plain language and provide an example. Pause, rewind, revisit this video anytime. It's here to help you grow and succeed. Let's get started. Let's briefly review what we'll get from this video. We'll define in plain language 25 of the 101 terms. This will strengthen your recall and help you to remember important terms about addiction counseling. It will build a strong foundation in terminology across theory, ethics, treatment, and documentation. Let's get started. Term 51 is mindfulness. Mindfulness is about staying present and in the moment, right here, right now, without judging your thoughts or urges. In addiction counseling, it helps clients recognize cravings without reacting automatically. Term 52 is naloxone. Naloxone is a life-saving medication that can reverse the effects of opioid overdose. Term 53 is outpatient treatment. This type of treatment allows clients to get support while living at home. It's ideal for people who need structure without full-time care. Term 54 is overdose. An overdose happens when the body can't handle the amount of a drug taken. It's often accidental and can be life-threatening. 55 is peer support. Peer support is support and help from people who have similar experiences. It helps clients feel understood and not alone. Term 56 is physical dependence. Physical dependence means the body has gotten used to a drug. Without it, withdrawal symptoms may happen. Term 57 is PAWS, post-acute withdrawal syndrome. These are long-term withdrawal symptoms that happen after detox. The client may experience symptoms such as mood swings, anxiety, or sleep problems. Term 58 is protective factors. These are things that reduce the risk of addiction. Protective factors help keep clients on track. Some examples are family, support, education, and safe housing. Term 59 is psychoeducation. Psychoeducation helps clients understand their condition and how to manage it. It involves teaching clients about addiction and recovery. This knowledge gives them more control of their recovery process. Term 60 is recidivism. This is when someone falls back into criminal and harmful behaviors after getting help. Programs like drug court can help break this cycle. Term 61 is recovery-oriented systems of care. This is a network of services supporting long-term recovery. This can include therapy, housing, job help, and more. Term 62 is relapse prevention. These are strategies to avoid returning to substance use. They include knowing triggers, having coping skills, and staying connected to people who support your recovery. Term 63 is screening, brief intervention, and referral to treatment. This is a process to identify and help people with substance use issues early. This brief tool is used in healthcare to catch substance use early and refer people to the appropriate help. 64 is self-help groups. This is a peer-led group for recovery support. These type of groups are powerful and effective because they are peer-led. It's support from people who truly understand and who have had similar experiences and struggles. Term 65 is serotonin. Serotonin is a brain chemical that affects mood. Low levels can make people more vulnerable to depression and substance use. Term 66 is smart recovery. This is a self-help program focusing on science-based tools. It also focuses on personal responsibility and practical ways to maintain recovery. Term 67 is social determinants of health. These are life conditions that affect health, like housing and income. It also influences recovery. Term 68 is sobriety. This is when you live without using drugs or alcohol. It is the foundation to recovery and living healthy and well. Term 69 is stages of change. These are the steps people go through when changing a behavior. Because change doesn't happen overnight, this model shows people how to move step by step towards action. Term 70 is stigma. These are negative attitudes toward people with addiction. Stigma is the judgment and shame people experience when they are struggling with addiction and substance use. It can keep people from getting help. Term 71 is Suboxone. This is a medication that helps treat opioid addiction. It reduces cravings and helps prevent relapse. Term 72 is substance use disorder. This is a condition where substances causes harm, and even though it causes a negative effect on the client's life, work, health, and relationships, it is difficult to stop. Term 73 is support network. These are your family, friends, and groups that help with recovery. Having a support network makes all the difference in recovery, especially during the tough moments. Term 74 is surrender. This is when the client accepts they need help and start to actively work towards recovery. Term 75 is synthetic drugs. These are man-made substances designed to mimic other drugs. They are lab-made and often much stronger than natural ones. Fentanyl is one example, a synthetic opioid that's very dangerous. It's time to quiz yourself. Let's check how well you remember terms 51 through 75. I'll read the term, I'll briefly pause, and you can jot down the definition or define it to yourself. Either is fine. Don't worry about getting it perfect. This is about practice, not pressure. Let's begin. Mindfulness. Naloxone. Outpatient treatment. Overdose. Peer support. Physical dependence. Post-acute withdrawal syndrome. Protective factors. Psychoeducation. Recidivism. Recovery-oriented systems of care. Relapse prevention. Screening, brief intervention, and referral to treatment. Self-help groups. Serotonin. Smart recovery. Social determinants of health. Sobriety. Stages of change. Stigma. Suboxone. Substance use disorder. Support network. Surrender. Synthetic drugs. Here's a quick reminder on how to lock in these terms to make them stick so you can remember them. First, say it out loud in your own words. When you can explain a term clearly, you know you understand it. Secondly, connect it to a real-world example. Picture how this term might show up in a session or with the client. And lastly, quiz yourself often. Repetition is key. Make sure to hit the subscribe button right now, like this video, and check out more study questions right here on Tiesha Talks Mental Wellness.